Organ transplant recipients have a highly increased risk of cutaneous squamous cell carcinoma. This group of patients have an increased risk of up to 100 times as compared to the general population. Sensation of pain is a powerful warning signal for invasive cutaneous squamous cell carcinoma in organ transplant recipients. This has been reported in earlier studies conducted by our co-authors. In this current study, we intend to study the impact of painful skin lesions and cutaneous squamous cell carcinoma on the overall mortality risk in organ transplant recipients. We followed 410 organ transplant recipients in 10 different centers across Europe and North America during the periods between 2008 and 2015. These are centers dedicated to skin surveillance in organ transplant recipients in Europe and in the United States. These patients had been enrolled in an earlier study to define warning signals predicting cutaneous squamous cell carcinoma and had been included if they have a lesion requiring histological diagnosis. In this study, further clinical data such as occurrence of locally aggressive squamous cell carcinoma, metastasis, and death were recorded. There were a total of 410 patients with 812 skin biopsy specimens. Cumulative incidences of overall mortality were calculated using the Kaplan-Meier survival analysis, and risk factors were analyzed using Cox proportional hazard ratios. And these are the main findings. There was an increased overall mortality risk in organ transplant recipients who reported painful skin lesions with an adjusted hazard ratio of 1.6. There was also an increased risk of mortality in transplant recipients diagnosed with squamous cell carcinoma with an adjusted hazard ratio of 1.7. Mortality due to internal malignancies and systemic infections appear to prevail in organ transplant recipients with squamous cell carcinoma. This figure demonstrates that painful skin lesions predicted an increased mortality risk, as highlighted by the blue line. We also observed that overall mortality increased even further when the patient had 2 or more painful skin lesions. This figure demonstrates that squamous cell carcinoma or keratoacanthoma predicted increased mortality risk, as highlighted again in the blue line. We also observed that mortality from internal malignancies and systemic infections appear to predominate in patients with squamous cell carcinoma or keratoacanthoma. In summary, our study demonstrates that organ transplant recipients have an increased overall mortality risk if they develop painful skin lesions or are diagnosed with squamous cell carcinomas. Our finding highlights the need for close and long-term follow-up for this group of patients in view of the overall higher mortality risk observed.